Great, thank you, Smita, and thank you to the Global Health Council and MSH for sponsoring this forum. I think the topic of public-private partnerships in global health is really fascinating because I think over the last few years, and in fact, PATH has been engaging in public-private partnerships for throughout our over 30-year history. It's really important to think about how you craft those partnerships to be most effective and how you can leverage the core assets of both the public sector partner as well as the private sector partner in order to achieve the health goals that you're targeting. So I thought today I'll talk a little bit about sort of PATH's history in private and public partnerships, give you some examples of those, and then, as the other two panelists have done, talk about some lessons. And I think, as you'll see, there's actually some good overlap between the lessons that we've learned. There are a few other areas that I wanted to point out that are sort of a different lens on some of those lessons as well. So as I mentioned, PATH has been doing this for 30 years. Since the beginning of our organization, we have always engaged the private sector in creating technologies for global health. Over 30 years ago, we started in that space by looking at reproductive health technologies. We've grown now to include reproductive health technologies, maternal and child health technologies, vaccines, diagnostics. We have a broad array of different efforts that we have underway. And in every one of those areas, we engaged the private sector in order to achieve jointly the goals that we have with our private sector partners. Part of the reason why we believe so deeply in public-private partnerships is that we believe that in order to create sustainable solutions, things that don't require constant donations in order to support, that you have to engage the private sector in an endeavor that allows them to make a profit and continue with developing their activities. And so we recognize the need to support both business as well as the public health agenda. And we have to go about that by managing those objectives very carefully. A couple of things that we have noted along that way, there are a couple of different examples that I'll talk to you about. One is in the creation of vaccines, for instance. We have worked with a company called Intercell, which is a European biotech company. Intercell created a pneumococcal vaccine that they were originally developing to target the senior populations in Europe. Part of our vaccine development efforts are staffed with experts who evaluate different technologies and look at how well those technologies could work in the developing world. And in fact, Intercell's technology was quite interesting because we felt like you could take that exact same vaccine and use that to address one of the top killers of children in the developing world, which is respiratory disease. So we are working with Intercell to actually sponsor the clinical trials to test that vaccine in children in the developing world. And it's an example, a great example of how we've created a mutually beneficial relationship. That benefit is the technology for the global health perspective, the technology that Intercell has developed that creates a very effective vaccine. They have core resources and their assets are totally aligned to developing that product. PATH understands the developing world markets and the needs in the global health marketplace. And one of the symbiotic relationships that we've been able to establish with Intercell then is we've offered them the ability to enter a new marketplace, to expand their original market into a population that they had not previously considered. Now, many private companies don't expand into those markets because they perceive those markets to be incredibly risky. And that's the core value that PATH brings. We can help mitigate those risks. We understand what those market dynamics are. We understand, in the case of vaccines, what some of the global procurement processes are for organizations like Gavi or the World Health Organization. We understand what some of the regulatory environments are like. And so we can provide very valuable assistance, very valuable technical assistance to those private sector partners, expand their business opportunity, and at the same time offer a new intervention at very affordable prices to enable children in the developing world to be protected against pneumococcal disease. That's an example of something that I call sort of a global intervention. We also engage with very local partners. And so an example of that is a technology we call ultra-rice. Ultra-rice is a fortification technology for rice. And it basically allows it's essentially a pasta making process, to infuse into what look like grains of rice nutrients like vitamin A, like iron, the core micronutrients that many children are missing in the developing world. Our Ultra Rice project is engaged with private sector partners in India in the food arena, both in the pasta making industry as well as in the rice milling industry, to develop Ultra Rice products for India and distribute them. And in fact, today we're engaged in a program where 60,000 kids in India receive daily, through their school lunch programs, Ultra Rice. But that requires a very different market model than those global interventions like vaccines. Ultra Rice is an example of a local product where there are local manufacturers. Because of the economies associated with that business, you need to engage many local partners. You need to find innovative financing to help support the activities of those partners. And you have to help those partners who typically have less sophisticated business planning skills understand how they can approach that market and build their businesses. Both Ultra Rice and the pneumococcal vaccine are examples of ways that we work to provide a key asset that PATH has, which is an understanding of the marketplaces, whether those are global or whether those are local, and match them to the key assets that our private sector partners have, creating, as you heard from both Wendy and Joy, these mutually beneficial opportunities where there is not only an opportunity for the private sector partners to benefit from our experience and also potentially some non-dilutive financing, but also for those partners to create very sustainable products that achieve global health goals. There are a couple of lessons that I think are important out of this. One is, often the way PATH has worked, and we have been supported for a long time by USAID, we have had over a 20-year relationship with a program that we call Health Tech. Health Tech has helped to create a vaccine biomonitor, which is a temperature-sensitive label that is now used on all the vaccines purchased by UNICEF for distribution in the developing world. It helps ensure that vaccines are good when they're actually administered to children, to diagnostics for various infectious diseases, to various maternal and child health technologies. That long-standing relationship with USAID has provided us the trust in our relationship so that we effectively manage a portfolio of interventions. I think you heard Joy describe before that you have to be able to take some risks. And in fact, some of those risks may not pay off. But if you approach the public-private partnerships with a portfolio model, and you have the right set of experts on your team to evaluate the risk associated with various investments, you can actually create an overall portfolio that balances sort of the risk and reward across a basket of different projects, and enables you to be successful in places and learn in some places where those experiments didn't go right. So one important lesson that we've had is in working with the private sector is that we need to construct a portfolio of public-private partnerships. In fact, over in 2009, maybe it's 2010 too, we worked with over 160 different private sector partners. And that portfolio across all of our different programs is the key, one of the key assets that we manage in order to achieve the outcomes that we hope. And we know that not every one of those will actually be successful. But we also know that by working our portfolio in a very intentional and balanced way, we can ensure the effectiveness of those investments. The other thing that I think is important to think about is how the U.S. government can play a role in facilitating public-private partnerships. And that actually has been historically, from just a pure public-private partnership relationship, a very successful activity in the form of the Small Business Innovation and Research and STTR programs, the Technology Transfer Research grants. As many of you may know, a portion of all of the research money that the U.S. government agencies like NIH and DARPA and various agencies need to be allocated to small businesses to try and facilitate the transfer of technologies that have been developed through some basic research grants into the private sector. Those programs have been fantastically successful at transferring many of those technologies. The challenge from a global health perspective is that in many cases, those technologies have been developed with a view towards a global health agenda But as they've gone through the commercialization process, they've actually been redirected away from a global health application to what's perceived to be a more lucrative opportunity in the industrial world. And that's where actually recent events have come to help global health. The economic crisis has actually created a new realization in many of our private sector partners. And that realization is that in many cases, the developing world actually is what represents their growth market potential. And that they are more actively looking for partners like PATH and those in global health who understand what those developing world markets are like. So pairing sort of that portfolio model with this change in the economic climate, I think there's a huge opportunity to engage more meaningfully and more deeply in public-private partnerships with respect to global health aims. And then the last lesson that I'll point out is something that PATH has learned over time, and that is, again, speaks to actually some of the things that Joy was raising. As we've become engaged in these public and private sector partnerships, and as we've engaged a variety of partners, whether they're down at the local level, like the rice producers or rice millers in India, or whether they're engaged with big pharma, for instance, GlaxoSmithKline is one of our largest partners with our malaria vaccine initiative to advance the most advanced malaria vaccine. We need, as an NGO, the sophistication in business planning that our partners have. We have to be able to understand the issues that they're dealing with so that we can translate those issues into win-win situations for us and our partners. So at PATH, we have a staff of probably 15 to 20 business people. They come primarily with experience in biotech, in pharma, in diagnostics. They come from the private sector, and they are working in a public sector organization because they believe strongly in our goals of marrying the public and private sector. And that key asset is what allows us to manage those complex relationships and achieve the two sets of goals that overlap, both PATH's goals with respect to global health as well as the private sector's partners' goals, which often have many global health components to them but have the sort of recognition that they need to be able to build sustainable solutions. So I think from a PATH perspective, public-private partnerships are sort of core to what we do. They have always been part of our DNA, and we always work to try and find mutually beneficial partnerships. If it's a one-sided relationship, it's not going to work. And we have to be able to offer as much value to our partners as our partners offer to us.